This is the Bartholomew Town Podcast.
Hey everybody, welcome into Rhode Island's podcast of record, B-Town. It's Bill Bartholomew here with you for new episodes every Tuesday and Friday. And of course, you can find hundreds of episodes with interviews from everyone from, Mario Hilario to Senator Sheldon Whitehouse, plus examining some of the biggest issues impacting the Ocean State on Spotify, Apple Podcasts, and RICares.com. You can also follow me at Bill Bartholomew on Twitter and Instagram, and join the Bartholomew Town Podcast Facebook group. Send me an email anytime, bill@ripodcast.com. Okay, today we are taking a look at an issue that has been impacting our community for a long time, and let's hope now, here in 2021, we're moving into a position where we can have honest conversations with each other and improve our community in terms of its strength, its resiliency, and its ability to heal overall. And that is with respect to substance use and those who are in recovery and all of the nuances and really mechanics that surround that conversation. We have Monica Smith, Machiste Rankin, and Diego Arene-Morley from RICares here with us to share their own personal stories and really try to connect with everybody about how important it is to be open and honest in terms of dialogue, in terms of with yourself and with those around you, especially for those who struggle with addiction, who are in recovery, and for everyone who touches those lives. And I think if we can just, again, going back to that honesty piece, if we can just be a more open and honest society as a whole, right? I think it builds community and it strengthens community in a way that not much else can. So that's the big takeaway today. I think this is a really important episode, and it's something that we've had on the books, frankly, since 2020 to make sure that we could get it done. I attended a workshop, I think it was in the fall, early fall last year, that was focused on the media and the language used around covering issues of substance use and recovery, and trying to, fend off some of the stigma that's still in 2021 associated with this issue writ large, and instead move into a place of mutual understanding and communicating, in terms of the media piece, communicating in a more effective and ultimately impactful manner. And ever since then, and certainly this is something that I think everybody has stories or has some kind of relationship with this issue, right, in one way or another. But this is certainly something that I think we hear about, okay, this is Opioid Awareness Month, or this is, whatever special occurrence in a particular day. But this is one of those things that, it's got to be 24/7, 365. If it's not, it kind of doesn't really work. You can't zoom in and zoom out of this particular dialogue. It fits into all things social justice, all things community building, and frankly, even on an economic level, there's a lot of pragmatic solutions that can come from a better understanding of those who are dealing with any type of substance use disorder, those who are in recovery, and those whose lives are touched by this issue as a whole. So thanks to all of you out there, the listeners, and you know what? We have seen enormous growth, not only in 2020, which was, in some cases, we had like 850% growth here in B-Town, but even here in 2021, you're spreading the word, you're talking about the show, you're sharing it on social media, you're really driving a grassroots broadcast. And we're doing something really special here, and it's a two-way street. I can only deliver the information to you, but for you to consume it and then share it and spread the word, that is also a major part of it. So I got to constantly say this at some level, but appreciate you tuning in here. I know a lot of you are appointment listening, Tuesdays and Fridays, and I know a lot of you, you try to catch up when you can. Some of you listen on the weekends, whatever it is, really appreciate it, because at the end of the day, the profiles, some of the stories we do they're important, and I do believe they help build the narrative of what Rhode Island is and where we're going politically, in terms of our media, in terms of our personalities, in terms of our arts and culture. But then we also have the ability to zero in, to zoom in on issues that are, again, that 24/7, 365 conversation, such as today's, and have voices from the community with unlimited time, well, within reason, describe their own experiences. And so that's what this platform is. And, it's a two-way street. from me to you and from you to me. And reach out again anytime, 401-524-6825. You can text me or send me an email, bill@ripodcast.com.
My name is Monica McMinn-Smith. I'm a person in long-term recovery, but I'm also a person with a skill set that is appropriate to lead an agency of other people that are in recovery. My recovery, I've been in recovery about 16 years now. December this year will be my 17th year. And it's been a long journey. The first year of my recovery, I really focused on myself with the therapeutic interventions. And I attended many social activities at a recovery community center in Portland, Oregon. And from there, my second year, I began to build trust with my family, stabilize those relationships. And then in that third year, I realized, wow, I've really been focusing on myself and my family. It's time to turn that efforts into the community. And when I began to turn those efforts into the community, I realized that really ultimately what I was healing was not just my substance use disorder. It was not just my methamphetamine addiction. It was the fact that I was a person who had trauma, and I had repeated trauma and intimate partner violence that really disrupted my ability to navigate my community safely. So when I had this realization, I really kind of began diving deep into the recovery community, volunteering. But I started to get this picture of a recovery agency that was holistic, that would focus on the individual, the family, and the systems that surround us. And it is those concepts and premises that I bring and have brought into RICares here. We need trusted human connections. We have a direct services program. We need safe housing. We have a recovery housing program. We need to be able to lend our voice to the political process. We have advocacy programming. And we also need for people to know, if you're serving us and if you're working in the treatment or recovery field, we expect you to know what you're doing. We expect you to have the most recent research. We expect you to treat us like humans that are able to change, because that's what the evidence and the research shows. And because of that, we have an education program. So all of those programs really work at targeting individuals, families, and systems. I'll pass it off to Machiste.
Oh, hi, I'm Rankin. I'm a former correctional officer, and I'm a person also in long-term recovery from alcohol use disorder. I think what I'm bringing to the table with RICares is principled pragmatism, understanding that the systems that we live in need change, but that change isn't going to come radically as a lot of people believe it will. It's not going to necessarily be incremental, and all revolutions are not necessarily bloodless. But at the same time, we want to make sure that we can move the ball forward rationally without creating such a disruption in the governmental systems that we need to live with that it destroys everything. You don't want to throw out the bathroom with the baby and the bathwater, so to speak. So in that, I understand the prison system, the criminal justice system, and trying to help to create reforms in that regard, because we need to stop talking about addiction as a medical condition while incarcerating people for what we keep saying is a medical condition. I think that we also, in the regard to housing, we need to stop looking at just the fact of someone needing a safe place to sleep and get down to an even more basic level of, where do you have a safe and secure place to use the bathroom, to urinate and defecate like a human being, where you're not squatting in an alleyway and worrying about someone discovering you. So with advocacy, as I'm the chairman of the advocacy committee, my job is to push forward those ideals like safe consumption sites, because the notion is, and the characterization is, that we're always going to see someone dying in a bathroom with a needle in their arm. It's not that way. Safe use is not an issue that should become a moral issue, right? You shouldn't have to die because you have an addiction, and you shouldn't be marginalized because of that. So I want to keep trying to push that and push it as far as I can go. I'll pass it off to Diego.
Thanks, Machiste. I'm the program manager at RICares. I'm also a person in recovery from alcohol use disorder, childhood trauma. Like many people in our community, I was taken advantage of as a child by a person in a position of authority. Alcohol, partying were sort of ways of numbing that. But sobriety was part of a much larger process, which we call by different names, but I sort of call a deeper awareness, a sense of agency over my physical safety and psychological development. Religion, yoga, family life are staples of my recovery today. And I think that's an important kind of thing for all of us to remember. It is not the substance use disorder tends to be about half, if not more of the time, a symptom of something bigger that needs addressing and that needs healing, community healing, unconditional love, and connection with others. It's not really about the use. In some sense, I never felt like I fully belonged anywhere. I was involved on campus with harm reduction and drug liberalization efforts on campus with a wonderful group called Students for Sensible Drug Policy. And yet I really found my home in the recovery movement because it's not a movement of dogmas, but of attraction, personal responsibility, mutuality, and respect for human dignity. So in this way, RICares represents many different recovery pathways because they're more than just 12 steps. There are lots of different communities of recovery out there. And we're kind of at the intersection of this amazing place, which is criminal justice reform, real cutting edge public health research, which, we work very closely with some of the best universities in the world, which we have right here in Rhode Island, and authentic grassroots organizing by the same people that are actually affected by the issue. And all of that is true, and we're not particularly partisan in any way. That's really cool. That's really cool and really unique. I want to make sure that we include our mission statement because it just captures it nicely. RICares is a grassroots effort focused on creating a socially just community for all Rhode Islanders impacted by substance use. So that's individuals and their families and the larger systems as a whole. Because we know that there are folks in government departments who have lost family members, and that has a whole ripple effect on the entire service delivery system, just that one time. And that happens over and over and over again all across the state. We approach stigma with an intersectional lens. That's also really crucial, and advocate for change. Thanks again for having us, Bill. This is really exciting.
Yeah, of course. And, I think when we look at 2020, and certainly now in 2021 going forward, but 2020 revealed the fragility and lack of sufficient infrastructure in a number of different elements of our Rhode Island community, particular zip codes, particular demographics, everything from the elderly population to those folks who are incarcerated. Again, certain zip codes. This is something, though, that impacts all 39 cities and towns, any status in terms of immigration, whatever. As you mentioned, it's an apolitical conversation. So my question is to anyone out there right now who somehow feels that they have successfully navigated the world without this broad issue impacting their small segment of the world, what's your message to them? What's the thing that most people don't understand about recovery and the community that you've developed around it?
I just want to start off by saying that I can tie in recovery into any issue, whether it's environmental issues, infrastructure, roadways, transportation. It is relevant at all levels in the community. It is not just an issue of isolation. So I just want to make sure that challenge me. If you don't think you're impacted by it, give me a call. Let's have a conversation and I will tie it into your life and make it relevant. I'll pass the others off to Diego and Machiste, see what they think.
I think one misconception, Bill, is that, people with substance use disorder are those who have, quote, hit rock bottom.
Yeah.
And there's no data that really backs that up. In the DSM-5, substance use disorders are a spectrum from mild, moderate, and severe. And for those folks on the severe spectrum, they may have a lot of disordered other life things that happen as a result of their substance use. Yeah. And that may be true to lesser degrees for mild and moderate. And of course, there are always co-occurring mental illnesses that tend to be there on each step, along the spectrum. There's room in the recovery community for all of those folks. There may be folks who have to say, you know what, I can never use any type of drug recreationally again because it's not safe for me and it's not worth it. There will be folks who can say, you know what, I can have a beer once in a while at a family barbecue and that's cool with me. Those people, both of them, belong in the recovery community. That I think is a big misconception. And I even think our clinical partners are still in the DSM-4 world, and we have to bring folks into the new spectrum of substance use disorder.
So DSM stands for?
Diagnostic Statistical Manual.
Just me.
Yes.
For those who didn't know. I would just say that for me, the intersectionality of recovery is the points of denial, acceptance, and truth, right? Because in any problem that you have in your life, there's going to be a certain level of denial, then there's going to be a certain level of acceptance, and there's going to be a certain level of truth. And to come to the real conclusion that you can actually settle that problem, you have to reach to the point, or you have to get to the point of truth. So like Monica was talking about, whether it's roads and bridges, whether it's personal relationships, whether it's taxes, whether it's schools, there's a denial about what needs to be done. Then there's an acceptance of what needs to be done. And then there's the truth of how you implement that through whatever organizational or governmental means that you need to execute on.
I take you inside breaking news and the biggest stories of the day impacting Rhode Island on Instagram at Bartholomew Town, Twitter at Bill Bartholomew, and inside the Bartholomew Town podcast Facebook group. I mean, I think everyone listening right now, if they're being honest about it, has had so many different interactions that have impacted your own life. I know I've had so many that in my world that have had highly negative outcomes and highly positive outcomes of friends, family, etc. There's one example I always go back to, which is that I had a teacher in high school. I went to Charahoe High School in the southern part of the state. That was one of the most important and influential figures in my life, in terms of just kind of getting me focused on politics and the music. He was a great musician, songwriter, really important person in my life and many others in my building, and did have a substance abuse disorder and ultimately did overdose. And what was most disturbing about this was it wasn't until several years after I had graduated that we started to understand the personal crisis that he was facing, because the administration of my high school blockaded that information, would not admit what was happening, and just kind of made believe that there was no such story. I still hold that grudge to this day. And that person is actually still an administrator here in this community. And I find that decision, that was a turning point in my life back when I was in high school, to go, wow, this can impact anybody at any time. And the ripple effect, as you mentioned earlier, is so powerful that now 20 years later, it still sits in a part of my body that I'll probably never be able to work out, if that makes any sense. So people who think that they can somehow sweep this under the rug or blockade people or somehow clean it up and create this fairy tale version of reality, are they amongst the most dangerous people when it comes to successfully navigating the community-wide challenge that RICares is involved in?
So I just want to say, Bill, thank you for sharing this really important. One of our, really all three of our recovery mentors, one of the most important recovery leaders in the state, if not the country, Ian Knowles, is on the Charahoe Prevention Task Force. He lives down there. We're very involved in a lot of different little pockets. I might focus on Pawtucket, Central Falls, Providence, but we have folks everywhere. Monica's in Burrillville. Like, we're all over the state. I would say that our job is to come in authentically and shed light and say, have a hard conversation, looking across in someone's eyes and saying, this really can happen. And I feel bad for those who want to sweep it under the rug, because they may be the most ill prepared.
Yeah.
For what is truly, truly devastating. And so in that sense, we got to go and meet those people where they're at and say, I get it. We've all experienced some level of denial, or it's not so bad. And only someone else, only another individual person can change your attitude on something that is very taboo. And I'm really saddened by the administration's approach in this case to sweeping it under the rug, because that I think has more systemic implications.
Yeah.
Yeah.
As an administrator, I just want to share that really irks me, because there are so many things that we can do. Employee assistance programs, internalize identifying leaders that are already in recovery, pairing them up with other staff members. We can pause, we can seek resources, bring in and outside entities. There are incremental ways along that transition process that can support individuals. And it doesn't have to be shameful. There are ways to ensure the privacy. There are ways to ensure that your workplace still is a safe place, that you're reducing risk and liability. There are ways to do that from an administrator's perspective.
I think also this speaks to one of the core things that RICares deals with, which is addressing stigma. And that, you have this avoidance to the admission that there's a problem, right? Because in a place like Charahoe, I'm originally from upstate New York, but I grew up here in Rhode Island. So I understand the places where certain things just don't happen, right?
Yep.
So you wouldn't have a high school administrator who has a substance use disorder, because that's just not what we do, right? That's something that would happen in the big cities where all those certain other kinds of people live, but not out here, not where we live in our nice Pleasantville type of communities. So I think that when we address the reality that addiction strikes rich man, poor man, beggar man, thief, prince, and pauper alike, much like death and taxes, well, taxes to a lesser degree, but
yeah, right.
I think that addiction kind of strikes at everyone, no matter how high or how low you believe you are on the sociological totem pole.
I want to wrap up before I give you each some time to just sort of your sign-off message, if you will. I attended a workshop, I think it was in the fall, looking back on it, may have been September. I remember it being warm out, that was focusing on the Rhode Island media's language and delivering of messaging on this topic. And I was fascinated by it. I was drawn into it. And even coming in with many personal experiences and I think an understanding of the crisis on a ground level basis myself, just how important it is for the media, which is, what a terrible term, the media, just has such a toxic vibe at this point. But let's just call it out. Channel 6, 12, 10, the Providence Journal, the Boston Globe, WPRO, B-Town, the Publix Radio, the local newspapers, everybody that's delivering information, how important it is to understand the nuances of addiction, recovery, and the community at large, and how to convey that message. Do you believe that workshop and subsequent interactions or reactions you've gotten have set the broad Rhode Island local media in a position where they can better share the stories that you're trying to convey?
I definitely think so. I mean, our goal, our tangible goal has been for all Rhode Island media to adopt the Associated Press guidelines, which they already should be adopting. So we're just reminding people of what the newest public health research, the best practices are. And that's going to be a slow process. But I think, I think that we can get there for sure.
All right, last couple of minutes here. If you each want to just kind of give us your sign off, your parting shots, but here I don't feel like that's necessarily what we're going to do. But words of wisdom here as we head out on this after this great conversation. I hope the audience enjoys this as well. And also, if you can sort of set up where people can go for more information if they want to get involved in any capacity online or reach out to any of you.
Sure. I'll pitch the first thing is if you're a person in recovery, share your story publicly with one new person, one new place, or one new thing. Share your story. A simple format is what it was like, what happened, like your transformational moment, and what your life is like now. And really focus in on that, what your life is like now. Recovery is possible. We're everywhere. Recovery spreads like a virus. And that's important because we now have a better public understanding of viruses at a very daily level. So recovery spreads, it does, and it's viral. We can make sure that one person, one place, one thing, share your story with someone new. That's one thing you can do. You can carry Narcan, regardless of who you are. If you're in recovery or not, overdoses in Rhode Island hit an all-time high in 2020. We lost 400 people. Across the country, it is at an all-time high ever recorded. That's crucial to know. It is Narcan and naloxone. It is as important as an EpiPen or as insulin as a mask. We use masks every day now. We should have the same access to Narcan. We can prevent overdoses. And Diego, Machiste, anything else?
Yeah, just for your audience, Bill, we will come and we have our stigma training for media, clinicians. We'll do a Narcan training, basic harm reduction, recovery 101. Anyone can email info@RICares.org. Email us questions, or if you want all of the above, virtual, in-person, we'll do so safely. I think the Narcan, it's like a mask. It's just something we should all have in our back pocket. The Surgeon General recommends that we all carry it. We can all carry it. The other thing that I want to mention is call your elected officials to educate them and educate yourselves about overdose prevention sites. Senate Bill S00116, introduced by some conservative and some very liberal senators. A really interesting list would basically allow us the one evidence-based tool that we know for a fact that Brown University Public Health supports, that Brown Medical School supports, that would reduce overdoses. So learn about that, and those are my two big points.
My parting shots would be to make sure that you have Narcan. Have Narcan in your first aid kit like you'd have Band-Aids in it. Reach out to your local politicians. Let them know, if they don't already know, that overdoses are on the rise and that they're not happening just in public places and spaces. They're actually happening a lot in private residences. And making sure that people have a safe space and a place to use is a good thing. We don't need people to die because they have an addiction.
Yep.
Right? I think that my last thing is for members of the minority population to know that there is no shame in living in a society that marginalizes you, beats you down, and tells you that you are less than every day, and you sometimes collapse under the weight of that. And when you are restricted access to affordable, quality health care, and you self-medicate because there is a place for you to get that medication on every block, on every corner in your community, do not feel ashamed of that. RICares and other organizations offer free aid and comfort, and peers are here to help you. Reach out. We'll meet you where you are.
One last thing is, Machiste, I love you. You're so amazing. Thank you. If you're recovery friendly, if you are a nonprofit or a business owner or an administrator in a school district, there's a way that you can publicly signal to all of your employees and to the public that you are a recovery friendly place, that you are invested in people in recovery. And that is by going to the Recovery Friendly Workplace, RI. You can sign up. You can get some tutelage from Jonathan Goyer. You can really hone in on how to flag your support to your community, how to flag your support to your own individuals. There are resources at all levels for our community.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.